Of course, there's a lot of overlap between cold, allergies, and sinus infections. In fact, most likely one leads directly into another. So sinusitis is caused by problems with the ability of the sinuses to clear mucus. Each of the sinuses makes mucus, and that mucus has to escape into the nasal cavity. And when it's trapped in the sinuses, that ultimately can lead to sinus infection. So any condition that causes swelling of the lining tissue of the nose and or sinuses can produce problems with drainage, with obstruction of those drainage channels. Cold, a viral infection, for example, as we all know, causes swelling of the lining tissue of the nose, nasal obstruction, and symptoms like that. And then if that swelling persists, it's not treated rapidly enough, that drainage problem then develops with the sinuses and a sinus infection can ensue. If the swelling that triggered the blockage in the sinuses clears up quickly enough, very often even a sinus infection can resolve without the need for antibiotics. Allergies similarly cause swelling, and that swelling similarly can obstruct the sinus outflow channels. So once again, allergies can then lead to sinusitis, and because with sinusitis, one of the hallmark symptoms is stuffiness, congestion, drainage. Once again, the overlap in symptoms is quite high. And so one of the ways we distinguish one from the other has to do with the duration of symptoms. For example, an uncomplicated viral infection would be expected to resolve in 10 to 14 days, whereas sinusitis will linger beyond that point. So even though the symptoms may be similar, the duration can be quite different. And so once the symptoms have persisted and have not responded to conservative therapy like saline sprays and over-the-counter cold remedies, then we start to consider sinusitis and the need for antibiotics. With allergies, the symptoms, of course, of allergic rhinitis, allergic inflammation of the nose, and sinuses is much more indolent and chronic in nature, and so we can't use time alone. And one of the other hallmark features with sinusitis would be facial pressure and perhaps facial pain. Although facial pain can be caused by many conditions, facial pressure and facial pain suggests involvement of more than just the nasal cavity, which would be typical for uncomplicated allergic rhinitis, but involvement of the sinuses, which then would trigger those additional symptoms.